Anyone who feels their knee creaking, their kneecap stuck, or has chondromalacia struggles to relieve that pain in the front of the knee and that sensation of a locked knee. But just moving that little bone in front of the knee won't make it loose. In this video, I'm going to show you simply the best step-by-step method I know to get the kneecap back on track at home without pain and in an easy way. I loved it. The first mistake I see people make is wanting to mobilize. Moving the kneecap without balancing the thigh muscles, the muscles that connect to the kneecap, because it's these muscles, when they're unbalanced, that pull the kneecap off track. So you can move it, but it will always go off track. If you don't take this first step, the first step is this. You will sit in a chair, keep your foot well supported on the floor, your leg completely relaxed, starting with myofascial release. You will grab the skin near your knee, try to wrap as much of your thigh as you can, pull the skin up, don't let the skin slip, and you will bend your knee. And stretch 5 times. It's not supposed to cause pain, it's just to feel that it's loosening inside 5 times. Move up the space of one hand, let me lift it a little more. Here. The pants, pull the skin again, hold it and do it 5 more times, bending and stretching the knee. Go as far as you feel comfortable. You'll feel like everything inside is tearing. Okay, take it easy. If you can, do it a 3rd time. But here, most people have difficulty and don't feel a sense of release like in the first 2 parts. After that, we're going to do a deep massage. Now you're going to make these rolls. Look, make a roll of skin and move this roll outward. This is going to be quite painful, so take it easy. I don't want you to hurt yourself. Use less force. Make a smaller roll. Go slower, more gently. You're going to repeat this all over your thigh for about a minute. No rush. Don't hurt yourself. Applause. The next step is to take care of the alignment, to take care of what pulls the kneecap down. In other words, by improving and unlocking the shin bone, we're going to center the kneecap and make it better, the knee. When you bend, when you walk, go upstairs, for example, stay seated with your foot firmly on the floor and try to keep your knee at about 90 degrees. Here, you're going to lift the tip of your foot off the floor. Keep your heels supported and make a windshield wiper motion, turning your foot outward and inward. Notice that it's exactly here at the knee. Let me turn a bit more like this. It's better for you to see on this camera that the movement happens. It's right here. There you go. Now it's well aligned for you to see. It's exactly here, right under my finger, that this movement is happening. You're going to do this movement at least 10 times, making sure to really focus when your foot turns inward. It turns outward and then really focus on turning it inward. Do this movement 10 times, no rush. This improves the muscles, strengthens the shin bone, the tibia, aligns the kneecap, but it also improves the ligaments, including the cruciate ligaments, and helps the menisci. I usually say that there's an easy exercise for each part of the knee, including if you want to improve your knee even more. I have a 2-week exercise program for you to do at home every day with 3 different exercises for you to balance your knee, align your whole leg, and start strengthening. I'm leaving the link to the Bye Bye Knee Pain program down below in the description for anyone who wants more information to know how it works and for those who want to start the 7-day trial.
Ew!
After balancing and aligning the kneecap, it's finally time for us to mobilize and loosen the kneecap. And I'm going to show you the right way to do this. Almost every problematic kneecap is a kneecap that is shifted to the side, or it's a kneecap that is positioned higher up. Either it's shifted to the outside or it's shifted upward. So when we're going to improve the movement, we need to correct this. Slide the kneecap inward and slide the kneecap downward. You're going to sit with your legs supported. Stay in a position where you can relax your thigh muscles as much as possible. You need to relax in order to move the kneecap. Let's start by sliding the kneecap from the outside to the inside. So you're going to make this hand position, this duckbill shape, and grab the outside of the kneecap. You can feel this little bone in front of your knee. Gently grab it and you'll feel the triangle pointing downward like an arrow pointing down. Hold it. Here on the outside, you're going to tilt your hand as if you're pointing toward the middle of the knee. And this is where you're going to gently push the kneecap from the outside to the inside. Look, this is what I told you about the muscle. My leg is relaxed, the kneecap is moving. If I tense up, the kneecap doesn't move, it gets hard, it becomes a hard bone. So relax. If your kneecap isn't moving, relax your muscles and you'll feel it nice and loose in your hand. You're going to push in this direction for 30 seconds, no rush. Remember, the idea here is not to use force, it's not to push the kneecap back into place by force. It's this slow little movement that's going to make the kneecap release. You'll feel it sliding on the cartilage. After 30 seconds, we're going to move on to pushing the kneecap down. Two things to be careful about. First, we're not going to grab the kneecap directly. Leave about a finger's width of space. You're not going to push the kneecap. You're going to push this little pad, this bit of fat on top of the knee. Second thing to be careful about, you're going to push the kneecap as if it were going to move over and in front of the shin. Push and you'll feel the kneecap slide down, and at the same time you'll feel a nice deep stretch here in your thigh. And come back, make this little rhythmic movement for another 30 seconds. Another problem for those who have a stuck kneecap is that pain when you get out of bed or when you sit for a long time. There are two movements that improve this like magic. I show these movements in this video here. Just click on the screen to watch. And if you got better or remembered someone who feels pain or has some knee problems, share this video with that person. That's all I ask. Make this video help relieve the pain of those who need it. I'll stop here. A big hug and see you next time.